Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. I'm very pleased today to have as my guest none other than Sri Velamoor, the President and Chief Operating Officer of Nextgen. Of course, Nextgen is well known, one of the major providers of electronic health record solutions for decades, really. Sri, thanks for joining me on this episode of the Tate Chronicles.
Jim, it's terrific to be here. Thanks so much for having me.
Our topic today is going to be AI. A lot of discussion about this, the appropriate uses of AI in healthcare, what's real now, what's on the horizon. But and so there's the whole concept of appropriate use cases for AI is really one of the most fascinating and evolving conversations today. In both administrative and point of care domains, there seems to be many potential applications, and really what we're looking for is when and where can AI bring low risk value is the question. Mm-hmm. And so I've read a little bit about an application that Nextgen has developed a release called Ambient Assist. What is Ambient Assist?
Yeah, Ambient Assist is our artificial intelligence supported clinical documentation tool. And the intention of it is to take on an area that every physician tells us is a challenge for them, which is the whole cycle of going through the pre-charting process, capturing clinical documentation, and then completing orders and meds and codes and all the follow-up activities that come. So physicians tell us they spend hours per day, roughly a third of their time on each of those sets of things. So Ambient Assist is intended to take friction out of that entire documentation cycle across all three of those stages.
If you don't mind, let's go really into the details of the workflow. Excuse me. So a provider walks into a room, there's a patient waiting there, and so Ambient Assist is launched. And is it capturing the conversation, or is there any manual input, or is it really based on verbal cues and things that are taking place in the room?
It is entirely non-intrusive, and that's the beauty of this, Jim, is to kind of carry forward the encounter as you visualized it. So the physician walks into the room, the patient's sitting right there. The physician has an iPhone or a mobile device where they've switched on the Ambient Assist capability, and they literally just set it down on the desk in a place where it can hear the encounter. And then they proceed to just have a conversation with the patient. And the whole time that conversation is occurring, the Ambient Assist tool is, first of all, it's transcribing the conversation using its voice-to-speech text technology. That's the first phase of it. Okay. And by the time the encounter ends, within microseconds, it is able to convert, once it recognizes that the encounter is complete, it is able to take that entire transcript of the conversation and analyze it and turn that into a structured, clinically relevant SOAP note and present that to the physician. So the physician can then literally scan that on their mobile phone and look through that discussion, present it back to them in the format of a note, and gives them the option to just press a button and push it into the EHR. That was the first phase of Ambient Assist. What we just announced in the last couple of days is the next phase of that. Now the physician, beyond just putting the SOAP note back into the EHR, they're able to take the same transcript of the conversation, and there's another tab there, and it has code suggestions to it. So the AI is able to turn that encounter discussion into a set of diagnoses codes that it references from its ICD-9 and 10 library. And it can present a few options to the physician to say, hey, here are some codes that I picked up based on the discussion you just had with the patient. Are these the right ones? Select the ones you think you want to enter. And the physician can click on those, and those get pushed back into the appropriate fields in the EHR, number one. Number two, it also discerns from the same discussion whether or not any recommendations were made about diagnoses or lab or imaging orders to be written. So let's say, Jim, you were talking about a bum knee and you felt like you had an ACL tear and the doctor recommended that you should get an MRI or an X-ray on that as part of our conversation. This AI tool now is able to write an actual imaging order based on this conversation that the physician can then look over and say, hey, here are some orders that I figured out, you talked about during the transcript. Can I generate these orders now and put them in the EHR? And the physician can look those over and they can press a button and it'll write those orders directly into the EHR. And then the other two things that are kind of happening behind the scenes is this entire encounter, the workflow we just discussed, it can happen in Spanish. And the AI is able to then turn that into an English note and do the translation. And depending on what specialty we're talking about, if it's a cardiology visit or a pediatric visit or a behavioral health visit, the AI also knows to look for very specific things related to that clinical specialty instead of just being a generic model. So it's really quite intelligent, and it's really taking a lot of that heavy lifting from the physician's hands. All they need to do is talk to the patient, and this thing does a lot of the heavy lifting for them.
I'm really fascinated by the workflow. And so the first part you talked about seems almost like speech to text. Maybe it's a more intelligent speech to text, the phase one. And that's kind of been around for some time. If the provider puts that smartphone on the table, it is obviously discerning the provider's speaking from the patient speaking.
Yes, it is. The AI has gotten really sophisticated, Jim. It's the speech to text has been around for a long time, as you said, but I think the accuracy level of the conversion has gotten better. Obviously, the multilingual support is a significant advancement. And then the other thing that these AI models have done is, instead of it just being a dumb translation of the conversation, what it's doing is it's actually able to separate out what's clinically relevant content that's being discussed versus, Jim and Sri are talking about the weather or talking about their favorite football team, and it knows how to leave that part out when it actually generates whatever it needs to for the next phase of this workflow. So those are some very interesting things that are happening behind.
And so at the end of the encounter, the provider pushes a button or does something, and there's some type of data flow that goes back to the EHR, or is there continuous kind of bi-directional activity between the EHR and the application?
Today, it's unidirectional. So at the end of the encounter, once it's been established the encounter's ended and the physician has reviewed what they need to, and this, frankly, is the differentiation, Jim, between why we believe our AI-assisted capability here is better than a generic one, because you could go out and download an AI model to do clinical documentation for you. But the real lift is to then take that outcome, take that note, and push it back into your EHR and into the fields that it belongs to in that system. Otherwise, you're really not saving that much time. Someone is then either copy pasting that transfer back, or they're trying to re-enter this data manually with the help of this AI tool. So we've actually built something we call direct to desktop, where once this encounter is done, whatever you're doing on your mobile device, we're able to take that entire payload and push it back into the EHR, and we've created that custom integration.
And so, there's been an attempt for the last few years so that providers are not behind a screen and on top of a keyboard during the encounter. Sometimes they have an actual human scribe. And so this is scribe functionality plus ordering suggestions and also clinical decision support. How does the clinical decision support work?
So that's a custom model that we developed. So the clinical decision support can happen in many different ways. So coding suggestions are one aspect of clinical decision support. Translating them into recommended orders is one of them. Turning it into medication orders or writing prescriptions. So there's a whole set of things that are on the wish list. We started out with codes and with imaging and lab orders as the first step. but we fully expect to push this now into the next set of things down on that to-do list as well. In the more clinical data guidelines that we can reference and create a model around to create a recommendation for a physician, the more models we can add behind the scenes and have this become more and more intelligent.
And in many EHRs, there are specialty templates. Are there specialty-specific models for Ambient Assist?
They are. In fact, we've launched the specialty-specific models for 5 areas. So cardiology, psychiatry, pediatrics, chronic condition management, and general family practice. So those are 5 areas where we've taken a generic model and trained the model to create specialty-specific subnote, specialty-specific orders, and encoding recommendations. So it knows that when it's a pediatric visit, it needs to look for certain discrete data elements that you normally would not ask for. Things like vaccine history and growth charts and things along those lines. And when you're in a cardiology visit, it's looking for other data elements because the model is trained on a clinical reference dictionary unique to that particular clinical specialty area. So this is the real game changer to make it even more context.
Let me take a couple steps back and kind of get your comments on something, Sri. So there are obviously use cases for AI in healthcare, kind of on the administrative side of things, scheduling, reimbursement, pre-authorization, things like that. When AI is brought into actual healthcare delivery, we certainly have to be much more careful. And so it seems like that what you've taken on with Ambient Assist is for lack of a better term, the lower risk areas.
100%.
Yeah.
And that's very intuitive of you to notice that, Jim. And you're absolutely right. We are all about, I should take a step back. I think given the space that we occupy in the workflow and the day-to-day interaction between a payer and a provider, we feel a greater sense of responsibility and accountability to mitigate the risks involved to health quality and to clinical outcomes. So the areas and the use cases that we've chosen are very deliberate. They are meant to reduce clinical risk, and they are very focused on 3 or 4 thematic areas. Where can we take advantage of AI to simplify searching for information? Mm-hmm. Where can we use it to help with summarization, for instance? Where can we use it to provide recommendations on decision support capabilities that are benign, right? So this is not going to diagnose whether a patient has a certain illness or not. All it's doing is saying, because you mentioned left knee, ACL injury, here's the code, for instance, that goes with that particular reference dictionary. It doesn't have the ability, or it doesn't tell you whether the patient has an ACL tear. So it's a fine line, but we've been very thoughtful about only picking the areas where we can be a co-pilot or an augmentation to the physician's judgment, not a replacement.
And obviously, we're so early in this wave of AI in healthcare. Kind of as you suggest, we have to tread lightly until the risks, are identified. And I guess it was Hippocrates that said, "First, do no harm." To our audience, if you just joined us, I'm Jim Tate. On this episode of the Tate Chronicles, I'm speaking with Sri Velamoor, President Chief Operating Officer of Nextgen. Let's talk a little bit more about AI and clinical decision support, not specifically in your application, but just generally. We know that one of the dangers, certainly, of automating healthcare, or really any industry, but especially healthcare delivery, is algorithmic bias. And so that is certainly not what you're dealing with, but the folks who are developing predictive as opposed to evidence-based clinical decision support are relying on giant large language model databases, and to make sure that those databases reflect, I guess, the full breadth, depth, and width of the human genotype. That seems to be a little bit of a gray area now, just like it has been for years in clinical trials. So there's some areas where, kind of getting back to what we've been talking about the last few minutes, Sri, we do have to tread lightly.
We absolutely have to tread lightly, and you're bringing up a great point, which is, where is this all headed? I think the generic large language models that are floating around out there, obviously they're dealing with, tens of millions of parameters and tokens that they relied on to build their probabilistic models and their predictive models. If you were to just go pick up ChatGPT or Anthropic or Llama or one of those, you could probably get by and do a fair bit of things, but it would also introduce hallucinations, which is the term that folks use for the kinds of error rates and the biases that it might generate. And we're certainly aware of that. And we actually believe in healthcare. That's why we're seeing at least several companies figure out that training your models, or at least starting with a open source model or a public model, but then fine tuning it based on training data sets that are more focused on healthcare or that represent specific data samples or population samples, are one way in which you can de-risk the performance of these models or enhance the performance of these models. And sitting where we do, and of course, many of the large entities in healthcare have size and scale to do this, but if you have access to tens of millions of encounters per day in a particular clinical specialty, the odds that you're going to build a specialty-specific model that is more accurate and introduces bias and less risk is significantly higher. The challenge in the industry has been, where do you go to go find these training data sets? And how do you make these training data sets available in a secure environment and platform where it's not even a one and done, but you have the ability to come back and test these models again and again on those training data sets and observe how it's delivering better outcomes and better results over time. It's auditable, it's observable, and it's reportable back to the government. So we have some work to do to solve that problem, but there's certainly some interesting developments that are happening.
I can remember, not the most recent HIMSS conference, but the one before, I guess, in the spring of 23, which makes me think that ChatGPT was released maybe, I'm guessing, in November of 2022. And so within 4 or 5 months, almost every vendor at the giant HIMSS conference claimed AI because they could push a button in a patient's record, and essentially ChatGPT would create an exercise or diet plan based on the data in that EHR. It was kind of neat, but it was also kind of a one-trick pony. And so a year and a half to 2 years later, the advancement has really been phenomenal. So I guess the question I have for you is, where do you think this is going in the next 2 or 3 years? I can't look 5 or 10 years down the road, Sri, but I can look 2 or 3 years down the road. What do you think is coming in terms of healthcare and AI?
It's really fascinating. To your point, ChatGPT was launched around November 2022, as you said, right? And we're just a few months away from it being 2 years old. But it went from just being this text capability to just so much more, right? At least 3 other versions have been released, or 4 versions in that interim period, several other models. As you look ahead here, I think there's an interesting fork in the road. How quickly AI develop in the next couple of years, I think, is a very interesting answer. How quickly will healthcare adopt those developments is an entirely different answer. The AI piece seems to have gone from, go to a chatbot and ask it a couple of simple questions and have it answer to, what folks reference as multimodal AI.
Yes.
Where combination of the speech, the text, the visualizations, the graphics, everything is extremely sophisticated to the point that you can create, just about anything that you want to at this point in time. So I've even seen videos of folks that took a picture of themselves, recorded their own voice, and within milliseconds were able to then generate fresh videos of their own faces speaking 26 different languages, and able to publish that. So the broader kind of multimodal AI capability is fascinating, and it's increasing at an exponential rate. On the healthcare side, the adoption of these large language models, these small language models, I expect will continue to be deliberate. The areas where I think healthcare is likeliest to adopt these tools is going to be governed by our incentive and our reimbursement models, not by the pace of evolution of the technology. That's fortunately or unfortunately always how healthcare has worked. A lot of we've had automation technology, we've had advanced analytics and big data capabilities in healthcare a long time, but it took us 5-7 years longer than every other sector to adopt them because we couldn't get the stakeholders past the incentives and the impact of their profit pools of dealing with that information asymmetry. And we're seeing the same thing happen with AI. We're looking at where can AI address staff shortages? Where can AI reduce admin cost? Where can AI help self-service? Those are areas where the economics govern the use of AI, and the incentives are very clear to adopt it very quickly, and we'll see that accelerate. And in areas like you said, predictive decision support interventions where there's a high degree of clinical quality risk and where there's a high regulatory burden, I think the incentives are just not in place for us to jump into the latest version of these models whole hog. So it'll take a significantly longer run rate for us to test those and build those.
When I guess it's been about 10 years since the federal government had their incentives for the acquisition of EHRs, really stimulated the entire industry. And then there was an incentive period for providers, kind of financed by regional extension centers, to train providers how to use the EHRs to reach something that they defined as meaningful use. And these types of financial incentives or disincentives continue with the macro MIPS program, Medicare reimbursement adjustments, things like that. AI, the use of AIs and the training of AI and the potential of AI seems outside the scope of any government kind of mandated, here's the direction we think is good to go in. And so, excuse me, that's probably one of the reasons AI is developing so quickly in healthcare. It's because there's no top-down focus on a particular direction or anything like that at all. So to me, and I don't mean this in a negative way, but it's a little bit like the Wild West, where all these different models are being trotted out there. Some, like Nextgen's Ambient Assist, seem to solve some really sticky, time-consuming task. Not only save time, but actually support and really raise the quality of healthcare. But there's so many other AI models out there that I'm not even sure what they do. And so it's good to see the kind of work that y'all are doing at Nextgen. What is on the horizon for Nextgen in terms of AI, or are you just waiting to see how Ambient Assist works out?
No, before I answer your last question, maybe a quick comment on your point. I think you noted astutely, right? Meaningful Use and the HITECH Act was introduced in 2009.
Yes.
And it took us almost 13 or 14 years, if you will. As of 2022, we still only had about 80% of all ambulatory and 95% of all practices using electronic health record systems, even with the government issuing meaningful use incentive payments to people. So it took us 14 years with EHRs to even adopt that. And in many ways, right, you could argue AI is going to likely follow a similar curve. It'll take some time for it to roll out through the whole system. And it's been a little bit of a free-for-all, but not entirely Wild West. Mm-hmm. The Office of the National Coordinator in healthcare, at least, issued a new requirement they called HTI-1. That was published in January, that starts to look at decision support interventions and certification requirements associated with those. So that's a good start, at least,
Absolutely.
to bring some of these models within HIT providers under the mix. And the FDA similarly has some frameworks that they've issued for biological research and for drug evaluation and research, and they're publishing their own guidelines for how to use AI/ML in the development of drugs and biological products. So that's a good start. Hopefully, they're playing catch up, but they're at least doing something about it.
That's true. And as you mentioned, the certification criteria around clinical decision support, which you have to have certified to meet the requirements for how ONC defines a base EHR. Very strict functional requirements around AI use in clinical decision support. Well, Sri, we're almost totally out of time here. Time just flown by. But before I let you go, how can listeners find out more about Nextgen and Ambient Assist specifically? And are there some YouTube videos out there? How can people find out more about this?
The best place to go to is to go to nextgen.com, and you'll learn all you need to know about Ambient Assist and how we're creating AI-based allies to improve the physician experience and take friction out. So that's going to continue to be our main focus.
Great, thank you. To our audience, thanks for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Sri Velamoor, the President and Chief Operating Officer of Nextgen. Sri, thanks for coming aboard today.
Delighted to be here, Jim. Enjoy the conversation.
You can find more information on this show's program page at healthcarenowradio.com. That's healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.